Hello, everybody, one and all. Here's our another lecture on psychological disorders from chapter 13 in psychology class. So we previously talked about what is abnormality um, and what causes abnormality. It can come from the body, which is biological. It can come from uh, a conflict between the unconscious and conscious mind. It can come from one's culture or society, or also from the way a person thinks and behaves according to those thinkings. So, otherwise known as thoughts. Anyway, we're now going to get into types of psychological disorders, and there are so many, and I'm really not going to try and bog you down with every type, but I do want to walk you through a few of the ones I think you should know. Now, as an accompaniment to this homework, hopefully this video will help you decide on this particular assignment right here, which I should have handed you in class, to read each scenario, each little vignette story, and decide what disorder that they have. Now, you don't have to do a perfect job at doing it, just use the information from this video, and please use the information from the book if you need more information to make the best assessment you can. And then we'll share out these the results of these on Monday. So let's get started. Before I begin, I need to mention one more time, and I hope I mentioned this in class, but numbers 2, 8, 9, 11, and there's no 15. 11, 9, 8, and 2. You will not be doing those particular questions, but all the others you can do. So that should be about 10 questions. Just 10 questions. Take your time with it. No rush, but just make sure you have your answers ready for Monday and why you chose a particular disorder as a diagnosis for each question. So let's get into it. So once again, this is going from chapter 13, module 32, types of psychological disorders. I won't be going over every type that's in there. That's too exhaustive. So I'll simply go over the ones I think you should know. So first of all, we're going to try and hit lesson objectives 32.1 to 32.4 in this particular lecture. I'm probably going to actually not do lesson objective 32, but maybe in the next video we'll get to 32.5, 32.6, 32.7, and 32.8, in addition to 32.9. Let's get started. So what is the DSM classification system? So what you have to understand is that we use tools to measure whether someone has a psychological disorder or not. We assess their abnormal behavior and look at many different factors and sort of try and make a good assessment of what type of psychological disorder they have. This is where the DSM comes in. The DSM stands for the Diagnostic and Statistical Manual. Now, the current one we have is the DSM-5. In here it says, version 4 text revision, but in 2012 a DSM-5 came out, and it was a little bit of a change from the previous one, but it is a manual with all the psychological disorders. It describes what they are and also describes their symptoms, and it's sort of used as sort of a checklist, almost like a Gray's Anatomy, but for the mind. Some people have called it the Bible of psychiatry, and it's really isn't that. It's just a measuring stick that's used when trying to treat someone or discover what their disorder is, if any. But this is important to know. It is, for better or worse, an effective tool for diagnosing people with psychological disorders. It's not a Bible, but it's just good guidelines. it has a particular organization in it, but the axes aren't really important. What is important is the idea that 1/5 of all adults over age 18 suffer from a mental disorder in any given year. And the DSM is very important for helping psychiatrists identify specifically what their psychological disorder is so that they can receive effective treatment and live a healthy, happy life. So, major depression has been found to be one of the most common psychological disorders worldwide. Millions of people face major depression. Um, so, for example, at any point you can pause this and take a look at this more. This is also in your book. But basically, this tells you the prevalence or the occurrence of psychological disorders in the United States. As you can see, major depressive disorder and dysthymic disorder, which are two types of depression, are the most common, and then everything below that is less common. Now, these are based on 2001 numbers, so what the 2018 or 2016 or 2015 numbers are, we're not really sure, but I would imagine depression is still number one. So what's really challenging about this is about diagnosing someone or labeling someone as having a particular mental disorder or psychological disorder is the fact that subjects change from time and place and culture and etc. And so there are many factors that need to be taken into account. And what's really important to know is that um, when you report your symptoms to a psychologist or a psychiatrist, it is based on your own reports. And if you don't want people to know you have a psychological disorder, then you might answer in such a way that would make it unclear to them and make it hard for them to diagnose. Another issue is the fact that um, the same traits or the same symptoms in one person that would give them a psychological disorder might be perfectly fine in another individual and not give them a psychological disorder for any number of reasons. The bottom line here is that um, even though there are symptoms that they're showing, and even though there is a book, the DSM, which helps identify these psychological disorders, it is by no means definitive. It by no means tells us beyond the shadow of a doubt what it is. So in your homework tonight, as you're doing your labeling of these particular stories, when you read about them and when you're trying to decide what disorder they have, please understand that diagnosing is not a perfect science. It's not a guarantee. It's not a promise. It's an estimated or educated guess. And the work you're doing on this assignment is the work that psychiatrists do every single day. So if you're frustrated or don't know, if it seems unclear, that's on purpose, because this is exactly what psychiatrists do every day. It's vague, it's unclear, it's gray, it's not black or white. So don't get too frustrated with the homework tonight. So we'll start with one of the first ones. We'll start with is anxiety disorders. So anxiety disorders, the main symptom is excessive or unrealistic anxiety or fearfulness or worry. And a lot of anxiety disorders are characterized by this sort of free floating anxiety, like it's always kind of hanging above your head. And it has nothing to do with any realistic known source. So, for example, seeing a bus coming at you or seeing a tiger in the forest would realistically cause you anxiety. But and with anxiety disorders, there is no good reason to feel anxiety. It just occurs, it just happens. Part of anxiety disorders is lumped in our phobias. We've talked about this before in the emotion category, and they are an intense fear of a specific object or situation. They can be developed by their environment, but it can be genetically predisposed, and these phobias can come from your biology. So two common types are claustrophobia, the fear of being in small spaces, or agoraphobia, or a fear of being in a place or situation from which escape is difficult or impossible. For example, an elevator would make people with these two types of phobias very afraid. Also labeled under anxiety disorders are panic disorders, which occur frequently enough to cause the person difficulty in adjusting to daily life. And what makes panic disorders difficult to maintain in daily life are panic attacks. And it's sort of, again, like we mentioned earlier with the anxiety, it can happen at any time for any reason. And sometimes it can be set off for a specific reasonable reason, but other times it's just a sudden, intense panic, sudden, intense fear, as if the person is dying. There's also obsessive compulsive disorder. These are two different parts. So, for example, you may obsess, you may think about something over and over and over again, and compulsive is you perform a particular repetitive ritualistic behavior over and over and over and over and over again. This is also referred to as OCD. There's also generalized anxiety disorder, which is just more of the same, and you feel this general anxiety overall for 6 months or more. Causes of these anxiety disorders, honestly, can come from any danger signal that represents urges or conflicts that are threatening to come to the surface. Again, this is Freudian behavior state that disordered behavior is learned through both positive and negative reinforcement. Cognitive psychologists would believe that excessive anxiety comes from illogical, irrational thought processes whereby the person engages in magnification, where essentially they make a mountain out of a molehill. They magnify, they make a problem bigger than it needs to be in their mind. And biologically, this could happen to chemical imbalances through incorrect numbers or dosages of neurotransmitters. And again, so much of form disorders we will not get to. But in our next video, I'm going to stop here. In our next video, we will get to dissociative disorders, personality disorders, mood disorders, and schizophrenia. For now, I'd like you to take this information as well as also going into the book in chapter 13, module 32 as well. Take your time to go through some of these. Again, do not do 2, 8, 9, or 11. Don't do those, but do all the other ones. Try to do at least 5 tonight. Try to do at least 5. And again, we'll discuss your answers on Monday. Have a good night, guys, and I'll see you in class tomorrow.